I'm Dr. Nicole Culos-Reed, professor in the Faculty of Kinesiology at the University of Calgary. I'm the director of the Thrive Center and the Health and Wellness Lab, where we look at the role of exercise for individuals living with and beyond cancer. So just think about it. Can you imagine when you're feeling your worst? You have the flu, you have a cold, and someone says, why don't you go exercise? Doesn't sound all that appealing. And that's really what we're talking about when we look at the role of exercise across the cancer journey. We're asking individuals who may be feeling sick from the effects of their chemotherapy, their radiation, or be dealing with later term side effects like cancer-related fatigue, and we're asking them to move more, right? But the evidence clearly shows that exercise can be so beneficial physically, mentally, emotionally, and socially if we can just have it supported and delivered to individuals along their cancer journey. And so that's really what we do. We build exercise programs that individuals can access at any point of their cancer journey to help enhance their overall quality of life. So we've been doing this exercise oncology research for about 20 years here at the University of Calgary. In the last couple of years, we've been able to build a program across Alberta called the Alberta Cancer Exercise, or ACE program, really building exercise to be part of standard cancer care. Very fortunately, we were funded by CIHR and the Canadian Cancer Society, as well as the Alberta Cancer Foundation, to take our Alberta-based model and bring it across the country. So Project Excel, Exercise for Cancer to Enhance Living Well, is really about reaching individuals outside of major urban centers where they might already have the access to resources, and delivering both online and in-person classes to individuals with cancer living in more rural and remote areas right across Canada. This is really groundbreaking research, being able to provide that access to safe and effective exercise programming for all individuals living with and beyond cancer. Most people understand that exercise or even moving more, physical activity, can be beneficial for them. However, when you've got those additional barriers, treatment-related negative side effects, you don't have access to safe and effective programs, it can be a real struggle to add in that wellness element across the cancer journey. So the goal of our research is to help make exercise accessible for all, whether we're speaking about our rural remote individuals, whether it's individuals who maybe speak another language, non-English speaking individuals, or whether it's individuals that are different ethnic groups or gender and sexual minorities. Our work is really focused on how do we address and tailor exercise to meet the needs and to be accessible to all of these populations, because ultimately we know exercise is one of our best evidence-based tools to support overall wellness and enhance survivors' quality of life. If you're a patient currently undergoing treatment, it may feel like most days the idea of exercising is just so far beyond where you're at. So we really encourage patients to simply think about moving more. It might be getting outside and walking from your front yard down the block and back again, or it might be something a bit more structured. The key is that every piece of movement counts. And you can almost think about it in terms of these little movement minutes or exercise snacks, right? Where you can get 5 minutes, 10 minutes, and it doesn't have to be vigorous, simply moving. I think many of us have experienced that sensation of, I'm tired, I'm stressed, I'm just gonna go outside and get a breath of fresh air, right? But you're going out, you walk a little bit, just having that change of scenery, taking in a few deep breaths, right? Can be really beneficial for you physiologically, but also mentally and emotionally. If you're familiar with Canada's physical activity guidelines, there are actual specific guidelines that are very similar for individuals living with and beyond cancer. So exercise oncology guidelines. And these guidelines really cover all aspects of fitness. So the guidelines state to optimize your health outcomes, whether that's physical, functional, or psychosocial, it's 90 minutes of moderate to vigorous physical activity, aerobic activity. And that's like your walking activities, your swimming, your cycling, anything where you're using your cardiovascular system, so your heart rate goes up and you're breathing harder. Moderate is like a brisk walk. You know, when you're late for an appointment and you've got to really start moving to get there, that's moderate levels. So that's the first part of the guidelines, 90 minutes of moderate to vigorous aerobic physical activity. The second guideline is around strength training. It's called resistance training. So that's using your own muscles. So you could, think of doing a push-up or a plank against the wall or on the floor. So using your muscles to generate force. That's resistance or strength training. And the guidelines are to get in 2 days a week. The last component of the guidelines is flexibility, right? So that's your stretching, maintaining an ideal range of motion around your joints. For many of us, and especially if you've been diagnosed with cancer, think of like the extra driving to appointments, sitting in waiting rooms, the stress. We tend to hunch, we tend to get stressed out. And so rolling through the body, I always tell our participants, scan from the top of the head to the tip of the toes each and every day. And really just dynamic movements, rolling out and stretching, releasing tension through your muscles around those joints. So those are really the three components of fitness. And the evidence clearly shows that, whatever you do, as long as you do it regularly, will afford the benefits. It's also really important to note that it's not an all or none. So even though we've got that 90 minutes of aerobic and the 2 days of strength training, if whatever works for you, your habit of movement is less than that, you will still accrue benefits, right? You'll still get benefits if you do mild level. So just a really low walk, just being mobile will afford you benefits. So good to have the gold standard, but really important to note that it's about you starting where you're at and then just building in as much movement as fits into what your habit is, what your lifestyle is. The role of exercise and other really lifestyle modifiable behaviors is to support you in living well with and beyond cancer. And so really it's about empowering you to have those choices. And we know if we can build exercise into the cancer care system, you're going to have more support to guide you in those choices, to make sure you're finding the right fit and when movement or moving towards exercise is going to be best for you, your body, and your lifestyle.